Welcome back to Wednesdays Live with Kat and Steph. We are the Dysphagia Duo. I'm Kat Ledwig, registered dietitian. If you're new, welcome. If you're a faithful follower, welcome back. We're so happy to see you.
Hi, all.
So, Stephanie Pepper, speech therapist extraordinaire. That's my personal opinion.
Well, thank you, dear.
So, today we are going to make pureed pasta primavera. And so I am peeling a roasted or fire roasted orange bell pepper.
And it smells amazing.
It does smell really good. I should have started probably a few minutes sooner. This was never one of my strong suits when I worked in the restaurant and I had to do like an entire case of these. It took me forever. But that's okay.
You want me to work on that while you...
Nah, we're going to talk a little bit about anxiety. I'll have you get started sauteing our stuff.
Anxiety or GERD?
Oh yeah, we talked about anxiety last week. We're going to talk about GERD this week.
I'll keep her on track, folks.
Thanks. That's why...
Your notes might not match up.
That's why we're such great partners. Yes, so we're talking about GERD, also known as acid reflux this week. So if you're joining us, please say hello. Tell us where you're joining us from. We are currently in the great state of Michigan. Are we in Michigan? We're in Michigan. Okay. Yeah, so let's talk about GERD. If you have any questions as well, please put them in the chat and we will do our best to get them answered. So why pasta primavera? Well, it's pretending to be spring outside. It's sunny right now, but we had a snowstorm earlier today. It wasn't a storm. You're right. That's exagerating. We had some flurries.
That's us really wanting for it to be spring.
Really wanted it to be spring.
I mean, it is spring, but to not be winter.
Correct.
Winter, spring.
So what is GERD? It stands for gastroesophageal reflux disorder. So gastro would be the stomach, esophageal is the esophagus, and then reflux means that your lower esophageal sphincter, which is like a little muscle that closes, you've got one at the bottom and one at the top. The one at the bottom doesn't always close all the way, and that's the food that you put in your stomach mixes with the acid and then comes back up. Mm-hmm. So how do we manage this? The plastic is sticky. Once I get through with this, I'll rinse it and then I'll chop it up a little bit so we can puree it. So it adds a beautiful color to our primavera layer. So let's start with some of the symptoms.
Yep.
So I have struggled with reflux my whole life. I had my first episode at 5 hours old.
Oh.
When the nurse tipped me upside down to wash my hair and I aspirated stomach contents.
I didn't know that.
Yeah. Ended up in the NICU for a while. They had to airlift me out because I was in rural Washington State. So ever since then, I've had a weak lower esophageal sphincter. And I've kind of always had a little bit of reflux. So I try to be really careful with my diet because diet really makes a difference. So acid taste. If you get this weird acidic taste in your mouth, it's probably from your stomach. Mm-hmm. Not supposed to be there. So those taste buds are really important because they can alert you to something going on. Pain, otherwise known as heartburn, is a symptom. It's where most people, that's what most people think. And I'll have a lot of people that'll be like, I think I'm having a heart attack. I'm like, well, what's it feel like? And they'll explain it. I was like, no, that's heartburn.
I think a lot of people mistake the symptoms of heartburn
for a
heart attack.
Yeah. So inflammation of the lining of the esophagus, which can be painful or it may not be. Increased belching. So if you have air that comes from your stomach and you can push it up, that's typically a sign that you have some reflux going on. Hoarseness. So if you have a voice issue and it's hoarse, Steph might be able to explain that a little bit better to us at some point.
I can talk about it now.
Yeah, okay.
So if your voice is hoarse from reflux, you've got bigger problems because that means that not only do you have reflux, but you're aspirating it because none of that acid should even be close to your vocal cords.
Fascinating.
So if you do have reflux and you have chronic hoarseness, I would suggest that you see someone about that.
I did not know that. I learned something today too. That's pretty great. Okay. Next, dry cough. Similar concept here, or?
Could be.
So if you have a cough and you have no reason to have a cough, something's going on.
Could be a little bit of aspiration. It could be like more of a throat clearing, like you feel something there, which means the acid has come way too far up.
Okay. And then we have esophageal spasm. So I don't know if this is something, because I haven't experienced this myself, but if your esophagus is spasming, it may not be letting food go down all the way, right? Is it something you can feel? If any of you have had this happen, please.
It's painful.
It's painful? Okay. And then difficulty swallowing or dysphagia. Go figure.
Because if it reflux is high enough up, then you may have some inflammation in the pharynx, the pharyngeal area.
Yeah. Goodness. Okay. Bloating. So excess gas in your belly. And then for dysphagia specific reflux, we wrote down throat clearing when you're eating. And then LPRD, which I'm going to let you touch on while I rinse this.
Great. Okay. LPRD is laryngopharyngeal reflux disorder. So laryngopharyngeal meaning much higher than the typical esophagus area for reflux. It means it comes all the way up to the larynx or to the pharynx and aspirates into the larynx. So it's a pretty, you could even have nasal regurgitation with LPRD. It's a pretty nasty disorder to have, and it's quite painful.
I was going to say, people say that's pretty painful.
And
also,
people become very fearful of eating because of it.
Yeah, that makes sense. That pain is...
The pain, and then you could potentially feel a sensation of choking if you're aspirating. So lots of issues with that.
Okay, so causes and risk factors for GERD. I'm going to go through these pretty quick. Some of them are, they relate to what we're talking about. Some of them do not, but some of you might feel very strongly about some of these causes. So the first one is smoking. Anyone who smokes cigarettes causes some crazy things to happen to the blood vessels, and there are a ton of blood vessels around the esophagus, which can cause issues. So smoking, use of progesterone containing oral contraceptives or birth control. Those hormones can do weird things. Pregnancy, and this is why a lot of pregnant women complain of heartburn. Pregnancy decreases the lower esophageal sphincter pressure. So sometimes it loosens, and then you get more reflux with pregnancy. Hiatal hernia, which is where the diaphragm, which is a muscle that sits about right here-ish, there's a little hole in it where your esophagus goes through, right? So you have esophagus, diaphragm, and then it connects to your stomach. And if there's a little like hernia and your stomach or your esophagus comes through there, then it can reflux up without your lower esophageal sphincter working properly. Use of muscle relaxers. So if you've had an injury, those muscle relaxers can release that sphincter. Or use of NSAIDs, which would be things like ibuprofen, Advil. I know they're the same thing. Motrin, Bayer, aspirin, things like that. They can cause some irritation to that lining and those muscles and cause it to weaken. Being overweight sometimes is a risk factor, sometimes it's not. Reclining or bending over. Let me tell you, I was doing yoga one day, and I had leaned over, and this was first thing in the morning. Hadn't eaten or drank anything yet. Stomach acid. It was, I had to stop because it was so painful, and it was because I bent over. And it must have released.
Your sphincter wasn't working very good.
My sphincter wasn't working. And then constricting clothing. So if you wear tight clothing, Or if you're a woman that has a bra that is too tight, this could be a potential issue. And then diet. Did you know that?
No.
Crazy, right? That's one of the first things we recommend when someone comes in to see a dietitian with GERD is that you have a looser belt, looser pants, maybe don't wear spandex, maybe don't wear something, a bra that's so restricting.
Wow.
I know.
Craziness.
Didn't know. I know. You learned something too.
I know.
I love this show.
I don't have, I'm going to knock on wood right now and try not to make my dogs bark, but I haven't had a big issue with reflux, and I'm grateful that I haven't, because I know people who have severe reflux.
Yeah.
Or GERD.
Yep. So how do we test for GERD? Well, symptoms tell us a lot. So we want to know what you're feeling, because those symptoms tell us so many things. But there are some tests, and a lot of them we've already talked about, because a lot of them are the same tests that they use for dysphagia. So,
Well, because much of the time, dysphagia may have been caused by your reflux.
right. So barium swallow or x-ray, and I wrote down, it shows the narrowing of the lumen of the distal end of the esophagus. All this means is that down at the bottom, it's narrower than it should be. So it should be over here, and maybe it's only here. Does that make sense?
Yes. And I would like to just say very quickly about the difference between a barium swallow, where they're looking for reflux, and a modified barium swallow, two different diagnostic tests. So a barium swallow is one where they will have you drink your liquids sitting up or standing up, and then they lay you down and they look at what that barium does. In a modified barium swallow, they modify that, they modify the whole program, and you're only sitting up. You don't lay down for it, and it's only, the majority of the study is done of the swallowing mechanism. They do go down and look at the full esophagus, but it's not as detailed of the esophagus as a barium swallow.
Okay. So, and we have suggested to clients in the past that they ask to have that examined all the way down.
Right.
So that is sometimes something that we recommend.
Not all therapists do the full esophagus for a modified barium swallow. You may have to request that. It's not a given that they do it.
Right. So this is why we like to know what's going on with our clients, so that we can make proper recommendations that are best for you.
And help you advocate for yourself and request certain things.
Amen to that. So I think we should saute the pepper separately, so we can blend it separately.
Okay.
So we can have that as its own layer. Because this is, yes, we fire roasted this, but it's soft but not super soft yet. So it's going to need to be cooked a little bit longer. So we have,
Take out a few more.
Before I get into more of the details, so we have zucchini, we have asparagus, we have some broccoli, we have some green beans, we have some yellow squash, and then pasta and pesto. And we use the red lentil pasta because we thought it would be prettier as one of our layers.
We hope so.
We hope so. I guess we'll find out.
Yes.
Trial and error. That's how we do it.
That's what it's all about.
Okay, so the next test is the ambulatory acid probe test, or the pH test, which is where they take up a probe and they put it in your esophagus for 24 hours to measure the acidity level. And might I say, this sounds awful. I don't know, because I haven't the pH test.
Yeah.
I don't
go down pretty.
Yeah, they go down pretty far. Okay, and then the next one is the endoscopy, where they take the camera. They usually, most of the time, they'll put you to sleep. When I had my upper endoscopy, they put me to sleep. And then they just stick a camera down there to check everything in your esophagus out, check your stomach out. And a lot of times they'll go a little bit farther than your stomach into the very start of the intestine, which is called the duodenum or duodenum, depending on who you are and how you say it. Everybody says it different. and they'll just take a look at it. Sometimes they can take a biopsy. This is how they may tell whether you have a bacterial infection, like an H. pylori, which can cause ulcers. They can see if you have ulcers. They can see if there's anything that's inflamed or irritated. They can see if you have Barrett's esophagus, which is caused by long-term reflux. And if anyone has questions about that, send me a message later and we can talk about that a little differently. That's a whole nother can of worms. Yeah. And then the last one is the esophageal motility testing. And this would be the manometry, correct?
Correct.
So with the manometry, they're looking to see if the waves of your esophagus are working properly.
Yes.
Okay. We're going to talk a little bit more about that peristalsis, or those waves, later when we're comparing reflux to regurgitation.
Yes.
Okay. So medications. The medications that they put people on for managing reflux are either the quick over-the-counter one is an antacid, like a Tums, a Maalox, or a Rolaids, Mylanta.
Yep.
Sometimes. And the Maalox and the Mylanta are typically liquids. So if you have trouble with pills, those are the preferable ones because they're easier to get down and they coat on the way down, usually.
The other does too, but you have to chew it up and then you have to feel that if you have trouble swallowing, it's going to be
Difficult.
I'd go with the liquid.
Yeah. Okay, and then we have proton pump inhibitors, or PPIs, and histamine blockers. So I was doing a little bit of research today so I could clearly state to you the difference between these two. So H2 blockers or histamine blockers are not as strong as PPIs.
Okay.
So they both do the same thing. Let me go to my notes to make sure I say this correctly. So they reduce the amount of stomach acid that your stomach produces. And so they want you to take them at the same time every day usually. And typically this is 30 minutes before you eat in the morning.
Okay.
That's pretty standard. Now, if you have really bad reflux, they're often going to recommend that you take it twice a day, once in the morning and once in the evening, because they need it working all the time. Sometimes this is long term. At first, it's usually not. At first, they may say, take this for 2 weeks, we'll see if it helps, and we'll go from there. So examples of PPIs would be omeprazole, esomeprazole, lansoprazole. They all end in Zole, Z-O-L-E. These are things like Prilosec, Nexium, Prevacid, Protonix, etc. The H2 blockers are things like Tagamet, Zantac or ranitidine, famotidine or Pepsid. These are usually, the H2 blockers specifically are used to treat ulcers. So they're usually the ones they go to first. If you have pretty bad reflux, they go to PPIs, and the strongest dose they usually recommend is 40 milligrams twice a day. This is not uncommon. And if you are concerned, please, I would say go talk to your pharmacist, because the pharmacists are a wealth of information, and we don't use them enough, I don't think. Would you agree with that?
I do.
And sometimes they're easier to get a hold of than your doctor. Go figure. So pharmacists are absolutely amazing. Use your pharmacist. We'll talk about silent reflux and then the difference between reflux and regurgitation, and then we're going to talk about some food stuff related and some strategies to help reduce your symptoms. So silent reflux is where you don't know that the stomach acid is coming back up into your esophagus. There are typically no symptoms with silent reflux. And I think that in some people, they're just not listening to their bodies super well. But in some people, they really have no symptoms. And
or
so
they may think, it's always been like this. So,
or
it always feels, yeah.
Yep, or it's always been like this. So if you don't know what good feels like, you can't know that that's a problem. Right. So one of the things that I recommend to all of my patients that I see is listen to what your body's telling you, because if you're listening, it will tell you. And sometimes that is an exercise that takes a lot of effort, because we're not always good at listening to what our bodies are telling us. Or you get a doctor that says, oh, it's all in your head. And so basically that says, don't trust your body. And I'm telling you, you need to trust your body. If someone, and Steph and I hear this all the time. They said it's all in my head. Guess what? I've had a doctor tell me that once at the beginning of this month. It's just stress. It's all in your head. Well, guess what?
It wasn't.
It may be in my head, but it's in my body too.
Right.
So listen to your body. If your doctor tells you it's all in your head, get a second opinion. Because we know that what you're feeling is real. Okay, I got off track with that. I do that sometimes. Steph usually has to reel me back in.
That's our model. I mean, that's what we do.
Yeah, we listen to you and what your body's telling you, because your body is smart.
Yeah.
And trust me, when my doctor told me it was all in my head, I told him to kick rocks. I'm finding another doctor. So
she did.
Okay, so then let's talk the difference between reflux and regurgitation, because yes, they both involve food in the esophagus.
Yeah.
When it's not supposed to be, but there's a difference.
Yes.
What's the difference?
So the difference is that reflux, or acid reflux, is what many of you have probably heard. Acid reflux happens when the food that you eat makes it all the way down to the stomach, and then refluxes back up. Yep. So it mixes with the acid and comes back up. So that acid is what the problem is.
Yes, and that acid causes a lot of problems.
It can cause a lot of problems, especially over time.
Yep.
Some of the worst dysphagia I've ever seen has been because of someone that never addressed it.
Mm-hmm.
And then regurgitation is different in that it is food coming back up, but it never made it all the way to the stomach.
So it didn't mix with the acid.
So there's no acid in it.
Okay.
But it's regurgitating back up. So it can cause a problem.
Yep.
Just like acid reflux can.
Okay.
But there could be a number of reasons why it didn't make it down to the stomach, and that's what we have to figure out. Yep. Is why hasn't it made it to the stomach?
Right.
Before it starts coming back up.
Right. Okay. Did you add green beans yet?
I didn't. Those are canned, so they're softer already.
Okay. I'm just gonna put a few right here then, because I don't think we need too many, right?
No. Are we gonna put it in with all the other green stuff?
I think we should. So we are gonna puree all of our green stuff together. We'll do our yellow squash a little separate, and then we have our pasta.
I'm gonna try to steam it a little bit.
Okay. So we cooked the pasta, and we saved some of the pasta water. This is red lentil pasta, so it is gluten-free. If you want to use regular pasta, that's fine. The trick here is to overcook your pasta a little bit, or a lot of it, depending on how soft you need it, because it purees better when it's still warm and when it's overcooked. We are going to add pesto. We also have some green onions, and we just have a bunch of veggies. So this is a meal that you can make with whatever veggies you have on hand. And I said broccoli, but I don't know that we're going to need broccoli.
Oh yeah, I do have the steamed broccoli, don't I? Do you want some?
Yes, I do, but no, I don't, because I feel like we've got a lot of stuff here.
Okay.
If we didn't have, I mean, it adds up pretty quick. So, okay, so let's talk food. My favorite subject. Okay, so first we're gonna talk. What are some herbs and supplements that can help with reflux? So, one, having appropriate gut bacteria. I'm sensing a theme here. We talk about gut bacteria all the time. So having a healthy gut bacteria microbiome is going to be really helpful. So sometimes we recommend a probiotic to help with healthy gut bacteria. Excuse me. The second is there are some herbal remedies that can be helpful in managing reflux. So this was recommended to me years ago. It's now expired. I did not finish the bottle. But this is, bear with me while I say this word because it's a rough one, deglycerinated licorice. So licorice has been shown to help support the stomach and reflux. So I have a thing of throat coat tea. This is just traditional medicinals. It's one of my favorites. My mom used to make this for me as a kid, so I have this weird attachment to it. A lot of people don't like it because it's licorice is one of the first ingredients. So, but it can be very helpful with the stomach. So my list here says licorice, chamomile, and marshmallow. Not marshmallows like the fluffy, sugary ones, but we're talking marshmallow root, which is an herb. She's never even heard of it.
I haven't.
I'll find some and show it to you. It's one of the coolest things
I want to
ever.
grow it now.
Oh my gosh, you should grow it. We're going to find you some. Okay, so in my tea there is licorice, slippery elm bark, which is really good for supporting those tissues. More licorice, organic marshmallow root, organic wild cherry bark, bitter fennel fruit, and cinnamon and orange peel. One of my favorites ever because they call it throat coat, and it literally does feel like it's coating your throat and your esophagus on the way down. So this is my favorite thing when I have a sore throat or I'm not feeling well. I drink this tea. Okay, so nutrition. How many calories should you eat when you have GERD? Well, we need you to eat enough because one of the things that we say for all of our people with dysphagia is your body can't start to heal unless it has enough in your body. So we need to get enough in you, and that's something that I specialize in. Protein, carbohydrates, and fats are roughly the same as normal nutrition recommendations, which if you're curious, once again, get a hold of me and we can talk about that. But the recommendation for fat for someone who has GERD is less. We don't want them to eat as much fat because fat, when you mix like oil and water together, the fat floats on top. Same things happen in your stomach. And if that fat mixes with the acid and then comes back up, it can hang around longer because fat has this great property of sticking around, right? It doesn't go anywhere very quickly. So we want you to eat less fat when you have reflux. So we recommend things like avoiding fried foods, avoiding whole fat dairy products, which is something I normally say they're okay to eat when you have GERD. Maybe not great, or you just need to limit how much you're eating to a smaller amount. Fiber. Also a theme here. I talk about fiber all the time. You need, as a woman, you need to eat 25 grams of fiber a day. And as a man, you need to eat 38 grams of fiber a day. So what this does is it helps to pull all of that gunk and send it through your system more efficiently. So it helps with digestion, and it can just help heal your body in general. She's going to blend some peppers.
Yes,
Ready?
I'm waiting.
Okay.
Ready?
Yep.
I put a little bit of the pasta water.
Beautiful. This is going to be so fun. And we're going to use these cups today.
And we'll be able to see the layers.
And we'll layer stuff. Yeah. Oh yeah, that's going to be gorgeous. I'm going to throw some pasta in here while she's blending that. Where's our pasta? Oh, it's on the stove.
I put the top on so it would stay warm.
Do we still have a spoon?
We do. It's right here.
Oh, okay.
Might be hot.
Stealing it.
Careful.
That's all right.
I'm going to go one more.
Okay.
So do you want the pesto in the pasta or in the greens? The greens?
The greens.
Yeah.
Yeah.
Sorry guys for the sound.
I do think I know you salted the pasta water because I watched you do it.
Yep.
I'm going to add a little bit of salt into this pasta. Yep. Because when we blend things, they change flavor. So it's really important that we manage that. Mm-hmm. Okay, so we've done pureed pasta in the past, but I'm going to give you a refresher. So I have, and it's not packed down, right? This is like the 8-ounce mark, so there's probably a little less than that volume-wise. And then I have water up to here. I'm going to add, actually, I'm going to blend first, and then I'm going to add more. All right. And then fluids. Recommendation, drink more water. It's always it's what I tell everyone. So with our pasta, we are probably going to need to blend this several times. And we're going to need to add more liquid because it's getting really thick here. So I would even say if you need your food perfectly smooth, we didn't cook our pasta long enough for you. It smells delightful though. Or it just sat a little longer and dried and just got a little bit dry, which is okay. So we're just gonna add a little more.
So the pesto is my pesto that I made with last year's basil.
Yep.
So I freeze it without the Parmesan in it. So
Oh.
I'm adding a little bit of Parmesan.
Okay.
Because that's what we do.
Yeah.
We freeze it without the Parmesan, then we add it later.
Yep. I remember you telling me that at one point. So why do you need to drink enough water? Well, because you need to keep your gut hydrated. You need to keep your bloodstream hydrated. But also, when you have an adequate amount of fiber, your fiber absorbs water, and so it's going to pull extra water into your gut. And if there's not enough water in your gut for that fiber to pull, it's bad news bears, man. You don't want that to happen because that can cause some digestive upset. So make sure you drink enough water to support the amount of fiber that you're eating. I don't think I've said that before. So very, very important. All right, blending one more time. So I added another ounce of water and it's still really, really thick. Okay. And these blenders blend for about 20 seconds. So that looks nice and smooth. So I'll show it to you there. See if you can see that. And then I'm going to just, it's smooth. All right. You know what I didn't add was any fat to this. And it's just got that kind of rough texture.
You can take a chunk of butter.
Butter? I like butter.
Or I have...
So olive oil, butter, canola, plant-based butter, all of those would work.
But that helps to smooth it.
But the butter is going to help this just a little bit. So you have to be careful because we are talking reflux. Don't add a crazy amount. Don't add more than you need. I'm going to add a little bit of water here too because this got really thick.
Did it?
Got really thick. Okay. All right. How do we want to layer? Do we want to do... Oh, I'm really excited about that.
I would, yeah.
It smells really good. Pesto is so delightful. And yes, pesto has fat in it, so usually we use olive oil, but it's also got some kind of nut. So pine nuts is traditional, but I've seen people that use pecans, people that use walnuts. You use walnuts?
No, I use pine nuts.
You use pine nuts, okay. You can use whatever kind of nut you want. Or, if you're allergic to nuts, you can make your own and you can make it nut-free. Mm-hmm. And it's still delicious because it's basil and garlic and maybe a little bit of lemon juice, Parmesan cheese, the nuts and olive oil, and that's it.
Yep.
So we'll have to make some for you this summer when we have some basil. Okay, so with your, what do we want you to do, let's say, nutrition-wise, in order to manage this reflux? We want you to consume a balanced diet with adequate fiber. So this is adequate fruits and vegetables, adequate whole grains, adequate protein, so well balanced. We want a variety of foods. Variety is the best thing you can possibly do. And we want them to be less processed. So we don't want high sugar foods, because sugar can also cause some very severe complications. Sugar, in the long run, ends up being acidic. And when you already have an excess amount of stomach acid, adding sugar or white flour or highly processed foods on top of that can just make this worse. So avoid high fat meals. So anything fried, potato chips, that kind of thing. If you want to have 1 or 2 potato chips, that's fine in the grand scheme of the universe, but don't eat a whole bunch. I'm trying to, yeah, okay. Maintain a healthy weight. Now, this one drives me crazy because it looks pretty good, right?
Wow, that is so smooth.
It looks pretty good. I know. So, if you look at this, it's beautifully smooth. So I did have to blend this 3.
That is,
and that butter
totally smooth. The butter helped it.
Was perfect. Okay.
I'm gonna get a regular size spoon and start.
Okay. So maintain a healthy weight. The reason this irritates me is because there is new research coming out that states that we know it's physically impossible for certain people to lose weight. Whether it's genetic, whether it's socioeconomic status, we should not be judging people for their weight. We should be managing them where they're at. So I will get off my soapbox before I go any further. But do your best to live a healthy lifestyle and eat a healthy diet, and we're not going to worry about your weight. Okay, so remain upright after eating and while eating. So this is something that we recommend for all our clients. When you're eating, make sure that you're sitting up straight. Your back should be as straight as possible. Please don't eat in bed, because it's easy to slouch and lean over, and none of that is good for you. We want you to be upright. So we know that the esophagus doesn't work based on gravity, but if you let gravity help, it's not a bad thing, right?
Right.
Avoid foods that exacerbate your symptoms. So there are some foods that we know make reflux worse. Caffeine, for a lot of people, makes reflux much worse. Alcohol can make it much worse. Tobacco use, which I already talked about, and then stress. Stress, did you know, can make your reflux worse?
Makes sense. You know why?
Tell me more.
Gut brain.
The gut-brain connection, which we talk about all the time. So if tomatoes, notice we didn't put tomatoes in this tonight. Tomatoes cause a lot of people problems with reflux because they're very acidic. Oh, that's gorgeous. Oh my goodness. So avoid those foods that are triggers for you. Chocolate, for some people, causes them reflux. For some people, it's cheese. For some people, it's milk. They used to say, if you have an ulcer, drink milk, or if you have stomach acid, drink milk. We're not saying that anymore because it doesn't work the way we once thought it did. If you, there are some people that not tomatoes, because tomatoes, I already said that. Apples cause some people reflux.
Really?
I'm one of those people.
Oh, I'd be in trouble.
I know, because they're so delicious. Oh yeah, that's so delightful.
By itself, it's so good.
Roasted orange pepper, telling ya.
Okay.
I'm so happy about this. Eat meals at least. Oh, gorgeous.
So we have pasta.
Really pleased with this.
We have
Pesto veggies.
Pesto primavera. And orange
Bell pepper.
Mm-hmm.
Oh, I'm so excited.
Yeah, keep going.
Okay. So eat meals 3 to 4 hours before bedtime. So we don't want you going to bed with a full stomach. But I am guilty of this sometimes. And once again, I do have reflux. Would that include tomato soup also? If tomato exacerbates your symptoms, yes, that would include tomato soup. So what I would suggest is eating a smaller portion and include something else with your tomato soup to see if that helps. Because sometimes it's about the amount and sometimes it's just about the food. So I would start with decreasing the amount that you eat, and if that helps, then you know it's about the amount. However, if your body just doesn't like tomatoes, it might just be the soup in general. So it's just like do trial and error with all this. All of this is trial and error for you as well. And so that's one of the things that we do with our clients is we try to help them through that process of trial and error, talking things out, because it can be very difficult to figure it out on your own. So next, eat a high protein diet. And with dysphagia, we know that getting enough protein in is very difficult. Speaking of protein, we did not add protein to this meal tonight. However, we could have added chicken, and I would have probably blended it with the pasta. Or we could have just added some pesto and blended it with pesto and made chicken pesto, which would have been really delicious. How is it?
It is delicious.
Oh my gosh, I'm so happy with that.
I am amazed at how smooth the pasta came out.
And so it's red lentil pasta. I was hoping it was going to be more red, and it's not, but I'm not even mad.
Well, and I overcooked it. We kind of forgot it.
I think that was the best thing.
I think it went 22 minutes instead of, what did the box say, 12? Hold on.
So we cooked it for 10 minutes longer. You know what? I'm not even mad.
Hold on. Keep talking. I'll tell
Okay.
you.
So eat a high protein diet. The other thing I was thinking about today was that if you have an unflavored protein powder like Isopure, you could add unflavored protein powder to any part of this while you're blending it, and that would add an extra serving of protein into your veggie meal.
That is a great idea. Or drink your protein.
Or
You
drink
could
your
have a
protein.
protein drink. I know Isopure has berry flavored.
Yep. Drink your protein. I'm parched. Hold on. Check out my fancy cup that I made, guys. I'm really excited.
She's become very artsy craftsy.
I like my crafts.
Yes, you're good at them.
Okay, so next, increase your fiber intake. I already talked about that enough. Consume fluids in between meals. This is also something that we recommend to all of our people that have swallowing difficulty, purely because you need to continue to drink throughout the day, because getting enough fluid in can be very difficult. So we want you to literally have your cup with you at all times.
It doesn't have to be that big.
It doesn't. I'm crazy, but you guys probably already know this. And I can't tell everyone else drink more water if I'm not doing it myself.
This is true.
Because I don't believe in telling people to do something that I won't do myself. Stephanie can vouch for this.
It is true.
Okay. So consume your fluids in between your meals. We also do suggest adding the protein drink as your fluid in between your meals if you're not getting enough protein during the day. Identify any foods that interact with medications. This is another thing we work with our clients on. We go through their medications and we take a look to see if there are any medications that are not agreeing with something that they're eating, because it's few and far between that this happens, but it does happen on occasion. Chew your food all the way. Don't swallow whole pieces of food. Now, to say this to the dysphagia community is kind of silly because you're not doing this.
Well,
I know
some of them are.
Do you think some of them aren't chewing their food all the way?
No, I think that some of them are having whole food and they're chewing it. Not everybody with dysphagia has to be puree.
No, I'm saying that I think most people, when they have a swallowing disorder, they chew in excess.
Oh.
So, like, my husband doesn't always chew his food. I'm sorry if you're watching. Love you. he doesn't always chew his food all the way. I guarantee my brother, who's probably not watching because he's not on Facebook, doesn't chew his food all the way. And so they're still swallowing food when it's whole. I know I've been guilty of this in the past. Make sure you chew your food all the way so that by the time it hits your stomach just has its job to do and not the job of your teeth also. Okay, I'm almost done, I promise. And then the last recommendation I have, physical activity. Try to get at least 90 minutes per week of some kind of physical activity. 150 minutes per week would be best, which is 30 minutes, 5 days a week. This could be walking. This could be swimming. This could be yoga. This could be a number of things. However, if you do downward dog and you get reflux, stop. Do not continue. Go drink some water and probably take a Tums or something, because that's what I had to do. Sit upright. So physical activity, and like I said last week with the anxiety piece, physical activity is the best probiotic that you can take. It does really amazing things for your body. And when you're doing physical activity, it tells your stomach to digest your food so that it goes down instead of up. So that's all I got for today. We only got the one question. Thank you for your question.
Do we have any other questions?
Yeah. I'm going to eat more of this.
Burning. I know
I'm hungry and this.
The pesto was the right choice. It really flavors it. I put about a tablespoon for the amount that we made here.
It tastes beautifully. Yeah.
It's not too much, not too little.
We could have added more garlic. Oh, garlic is one that people typically say causes them reflux also if it's too garlicky.
Okay.
So, if garlic causes you reflux, don't eat it.
Well, and I mean, there's other sauces that you can put with your primavera, with your vegetables. If you can't,
you could make a beautiful sauce
out of
bell pepper, because it's really delightful. I highly recommend you all try it.
That's good by itself.
Yeah, I would toss my pasta in that and eat it with a little bit of cheese on top.
Yep. Good stuff.
So that's beautiful. There was something else I wanted to add about apple cider vinegar.
Oh yeah, talk about that.
Have you heard of this trick?
Yeah, Andrew did it.
Did it work?
Yeah.
Okay, so there is a recommendation out there in the holistic health community that says if you drink a shot of apple cider vinegar, it tells your stomach to stop producing acid, and then it decreases your reflux. So I have also tried this in the past, but it's so horrendously...
There are apple cider vinegar pills.
There are. So they also say that you can mix it into like juice or some other kind of liquid so it's not so harsh going down, because let me tell you...
You get used to it.
I never have. I tried it for like...
He hasn't used a PPI in 2 years.
That's good.
Yeah.
That's amazing. So I would take a shot of apple cider vinegar, and it does work. But getting it down, because it causes a visceral reaction when you drink it, it can be very painful. But it stops the other pain right away, and it only lasts like half a second.
Yeah.
So if you can tolerate apple cider vinegar, it works.
It does. I have proof.
But it can be painful. That's just my opinion, because I like apple cider vinegar. Like if you give me a salad dressing made out of apple cider vinegar, delicious. I love it on my salad. I can send everybody a recipe if they want that too, but theoretically, apple cider vinegar helps with reflux as well.
Right.
Depends on if you can tolerate it.
It's intense. It's very intense.
That's a good word. Intense is a very good word.
Intense.
Yeah, it does work. My husband drinks baking soda in water if he has heartburn.
Well, that's...
Because baking soda is neutral, or it's a base. It's not neutral. It's a base, and acid, when they mix together, it's like that volcano project you did in school, right? Where it same thing happens in your gut. So my husband will mix his baking soda into water and drink that, and then he has a big burp, and then he feels better.
Makes sense.
So
All right.
To each his own.
Right.
So if anyone has any questions,
Right.
we're here.
And we have created a beautiful dinner tonight of red lentil pasta with primavera with pesto, and the orange layer is just a sauteed orange bell pepper.
So you hand me the blend jet.
Yes.
So Janet, you can use another kind of blender for this project. We prefer the blend jet because I would say it's on par with a Vitamix.
In smaller portion.
Yes. So this one it's like a 16-ounce container here. It does not have a vented lid, so it's a little more difficult for hot stuff. But if you're doing room temp or cold stuff, it blends so smoothly that like the pasta in like a food processor, you're never going to get it smooth. Mm-hmm. In a Vitamix, you're going to get it smooth, but you have to make a larger batch.
Right. In
this, we made enough for the two of us, mm-hmm. and this is plenty. So it's called a blend jet. Will you hold yours up, because mine is, you can't see it super well. And the reason I like them the most is that the company has taken very good care of us. We have tried to communicate with them over and over again. They're very attentive. They're very helpful. They answer all our questions.
We even had a blend jet confiscated by TSA when we tried to fly with it, and they replaced it for us.
They did. So they're about $50.
Target, Walmart.
You can get them at Target, Walmart.
Costco has a 2-pack of them. Some Costco's
I think the one at Costco, I think, was a 2-pack for like $70, which is really darn good. So that's $35 a piece. My mom found one at Marshall's.
Okay.
And I think it was like $15 or $25.
Oh.
So you can find them other places other than from the company. I bought mine with the protection plan because I tend to break things, and I had to use it within 3 weeks, and it was 100% worth it. It was 300% worth it.
And just so you know, I didn't bring it down from the office, but you can get a bigger jar,
mm-hmm.
a bigger.
We have a 20-ounce one, and we have a 32-ounce one. So if you're making like a big pot of soup, you can do it in here if mm-hmm. you get the bigger. So,
yep.
We're a big fan. If you have to invest in a blender and it's just you,
right,
and it's USB rechargeable, it cleans easy, so it twists off right here, which is why TSA confiscated it, because I know this has pasta in it, so I'm going to try to be careful. So it turns red when you're taking it off. So the blades are visible here, which is why TSA did not appreciate that.
Yeah, I thought we were going to hurt somebody.
Yeah, we're not dangerous.
Nope.
But, and then it blinks white when it goes back on. So, yeah, we're a big fan. Yes, we forget about that because we've been using them. So we also like our Ninja.
So Ninja has a couple of sizes also. So the Ninja that's actually a smoothie maker is good, a good smaller sized one
mm-hmm.
as well. But the big Ninja has the capability of getting things pretty smooth too. You just mm-hmm. may have to blend it a little longer.
Yeah. We have recipes that we recommend, like blend it again. Well, with a Ninja or a food processor, you may need to blend things for like 5 minutes, which seems like a long time, but that's totally necessary. Which reminds me.
But if that's what you have, it works.
The other protein that would be really amazing with this dinner is salmon. So if you have some cooked salmon or smoked salmon mm-hmm. and you blended that and put a layer on that in here, that would be amazing. Another
thing would be shrimp. We do shrimp pesto a lot, so that would be good.
And
we've done shrimp before.
You could blend the shrimp with the pesto. Mm-hmm. Oh, that would be delightful.
Mm-hmm.
Good thinking.
Yeah,
we should do something with shrimp again.
We should
soon.
Do a seafood.
Mm-hmm. Okay. Are there any more questions?
All right. If not, have a great week.
Yeah.
We'll see you again next
Wednesday.
Next Wednesday.
If you have a food that you want us to make, let us know, because we don't always decide a week in advance what we're going to make. We think about the weather and what's on sale and
What we're hungry for.
So last week we did sandwiches because we had a request for sandwiches.
Mm-hmm.
So let us know what you want us to make, and we'll
make it.
We'll figure it out. All right. Thanks, everybody. Have a really
Have a good
wonderful rest of your week.
Bye-bye.